So I'm going to be doing a mobilization with an internal rotation bias to the AC joint. And so this is, if the patient's having lack of range of motion or pain, this would be indicated for the patient. And you would know your treatment is working if the patient afterwards has an increase of range of motion or a decrease in their symptoms of pain. And so what I'm going to have my patient do is I'm going to place my patient into an internal rotation bias by putting their hand back behind their back like that to place that glenohumeral joint in internal rotation. And then I'll place one hand anteriorly on the chest at the clavicle, the distal end of the clavicle, and posteriorly on the acromion of the scapula. And then I am going to provide a posterior force with my hand that's out in front on the clavicle, and an anterior force on the hand that is placed back on the acromion simultaneously. And you can do all of the normal joint mobilizations. You could do a 1 or a 4, which will be both low and high excursion respectively, but with the short amplitudes. And you could do 2 and 3, which would be more prolonged, long amplitudes at the beginning and end range of motion. And you would do 1 and 2 for pain dominant symptoms, and 3 and 4 for lack of range of motion.
Okay.